Hi there, I am so glad you're here. This is Sujata Martin. I'm a pelvic floor therapist, and today I'm going to teach you how to use dilators for your pelvic health. Now, let's start with the most basic question. Who needs to use a dilator? Someone who's having pain anytime they insert anything into their vagina, be it a tampon, be it the speculum that your OB uses to open up your vaginal opening during your OBGYN exam, be it pain with intercourse when you're trying to insert a penis or a sex toy and you have pain, dilators probably will help you. If you are someone who underwent genital surgery for gender affirmation, meaning if you're a trans woman, dilators should definitely be used to help with your recovery. Dilators are also a great tool to use post cancer surgery or radiation for cervical cancers or other surgical procedures in your pelvic area which can cause scarring of tissue. Dilators will probably help you. So with that being said, I do want to clarify, always work with a pelvic floor therapist when using dilators, because of course you can only learn so much yourself even from a video such as this. So find a good pelvic floor therapist to support you either locally, or a lot of us including myself do online sessions where we help people who are not in our local area but try and find a pelvic floor therapist to help guide your recovery. So let's understand dilation and how it can help get us feeling better in our pelvic floor. Now, most dilators are medical grade, or you should be using a medical grade dilator. Some of them are made of hard plastic, and the ones I like are these nice silicone ones made by Intimate Rose. Now, I don't have an affiliation with the brand. I just really appreciate how soft and flexible they are, and they feel really smooth on skin. So, starting off with dilation, first of all, to understand what size dilator to get. Most dilators come in sets. They come in sets of 6 or 8, with the smallest sizes being like really small like this, to the end sizes being really big like this. Now, which woman would use this? Maybe someone who wants to have sex with a male partner or female partner, and the penis is this size, or the object they want to insert with is this size. It's quite wide. And whereas which kind of woman will use this? The really small one, this is kind of like my pinky finger width. This is someone who has very severe pain with any kind of insertion in the vaginal area. So they would start off with this. So they come in a wide variety of sizes. This is the Intimate Rose set. This is size 1 and this is size 8. They do have intermediate sizes also, of course. This is like a 4 and I believe this is 2. So, first of all, you may want to work with an OBGYN or pelvic floor therapist. Pelvic floor therapist preferably, to identify which size is right for you. Otherwise, you can just estimate by using a finger. Start with the pinky, insert it into the vagina, and if that is comfortable, then add in another finger. Then use your index finger, and if that is comfortable, then you would use 2 fingers. And again, depending on how far you're able to get, that will give you an estimate as to the size of the dilator. Now, if you have a condition called vaginismus or vestibulodynia, you probably are not going to insert more than a pinky finger or more than an index finger to start off with. Therefore, your sizes to start off with are probably going to be a size 1 or at most a size 2. So that's where you start off with sizing. To practice dilation, first of all, make sure you're going to be in a place where you feel safe and comfortable, where you will not be interrupted by your pets or your children, your roommate, someone who will just barge in, because when you get tight, when you get anxious or uncomfortable, your vaginal muscles will get tight. So dilation will be painful or uncomfortable. So make sure you're comfortable. Point number 2, make sure you're using a good lubricant. Water-based lubricants are the best. Make sure you check with the manufacturer of your dilator. They will specify certain lubricants that work best with their product. Number 3, never ever push through pain. Because what do we do when we feel pain? We crunch up, right? We pull in, we tighten. That is our body's normal response to pain. So if you're experiencing pain with dilation and you keep going, your muscles are just going to get tighter and then dilation is not successful. So patience is key with progress with dilation. So only progress up in your dilator size once you're able to achieve a good amount of dilation with the one size without any pain. So let's get started. So let's imagine you're going to start off with dilator number 2. That's where you are. You're going to find a nice comfortable space. You're going to use the lube recommended, like a water-based one or whatever your product manufacturer recommends. You are going to lube it up nicely. You're going to be in a comfortable position. So laying in bed or reclined like this with your legs up in a V, that is helpful, or one knee up bent and one leg out straight so you can access your vagina easily is also another option. So lube it up nicely and gently stay at the opening of your vagina. So if this is your vaginal opening, you're just going to be here. We're not going to push in, we're not going to be too aggressive. We're going to be nice and gentle. Stay here and practice your breathing. Exhale and relax. Deep breaths and feel your pelvic floor open and widen. This would also be called a reverse Kegel. Again, while you want to work with a pelvic floor therapist, they will teach you to do your reverse Kegels with the coordinated exhale as you insert gently. You will also be able to find guided meditations for dilation online, or if you're working with a sex therapist for your sexual issues, he or she may be able to share some guided meditations for dilation with you. So put your guided meditation on, do some nice deep relaxing breaths and just stay at the opening. Put some pressure downwards and breathe through it. Do that for 15 seconds. Ease up. Now gently, if you can, slide inwards just a tiny bit. Again, if it hurts, we won't do it. We'll slide back a little. So you'll slide back a little, stay there and breathe and relax and visualize that muscle opening up and relaxing. And we just stay there. We stay there for 15 to 30 seconds and see if we can go a tiny bit further. If we cannot go any further, we pull back. That's where we stay for this dilation session. So once you have found the depth that is comfortable to you, you stay there and you hold that for a total duration of 10 to 15 minutes. And you want to not necessarily move it out and in of your vagina. You want to put pressure on the walls of your vagina. So not necessarily up, because this is where your urethra is. We don't want to put a lot of pressure there. But if you want to think of the vagina as a clock, you're going to go from 1 o'clock to 11 o'clock and move your dilator, putting pressure outwards, like you're trying to gently widen the vagina. So gently widen, relax and exhale, feel that muscle, let go and relax. And you will hold each position on that clock for about 30 seconds to a minute. And you will keep moving down and around, slowly widening your vagina in that spot. If it feels good to you, you can continue deeper and do the same. And again, you will practice this once it is pain-free to go to the very end and practice your dilation. That's when you will level up. So I hope this little tutorial was helpful. If you have questions, do ask me below. For more good pelvic health info, subscribe and stay tuned for more such great tips. Till then, till I see you again, be well and may your pelvis be happy and healthy. You can find me here at Concierge Pelvic Floor. My name is Sujata Martin, located in Buffalo, New York. See you. Be well.